health care. So our administration has taken action to protect the reproductive care that is available and accessible to the women of America. In particular, the President has signed 2 executive orders which will protect reproductive health care, including permitting states to use Medicaid funds to help women travel and engage in interstate travel for care, within, of course, the limits of the Hyde Amendment. Also, our Department of Justice, the United States Department of Justice, has brought a lawsuit challenging the Idaho abortion ban and is clearly prepared to do more in terms of litigation as necessary to ensure that there is no conflict between these state laws and the federal law, which requires access to, and guaranteed access to emergency care. I'll close with saying this. Our colleges and universities are doing extraordinary work, and I know of work that is happening in particular around considering ways to protect students' access to care by instituting, for example, flexible attendance and leave policies so that students can seek care, by creating emergency funds so that students can afford care, and by clarifying confidentiality and privacy policies for campus health services. So there is good work happening here, and I really look forward to the conversation that we will have with these leaders, especially during these trying times. And so with that, I'm going to turn it over to the Secretary of Education, Cardona, to moderate and to start our discussion.
Thank you very much, Madam Vice President, for your leadership, but also for recognizing the impact that this has on our institutions of higher education, and for convening us today. The Supreme Court's decision in the Dobbs case has the potential to hurt students, faculty, and staff in our nation's higher education institutions. Students and others now have a new set of barriers to accessing health care, at a time when the pandemic has already put a strain on their mental health and overall wellness. Many colleges and universities are also concerned about how the decision will impact their medical teaching, their research, their ability to serve their communities. It has the potential to prevent them from doing what they do best. We've heard that from you. I'm encouraged that there are many colleges and universities and leaders who have stepped up to say that providing a full range of healthcare options, including safe, high-quality reproductive health care, will remain a top priority at their schools, especially in this moment. We must do everything possible to ensure that our students are safe and healthy so that they're able to learn and thrive. I look forward to listening today and listening to what we could do at the Department of Education to support you, but also in our whole of government approach to make sure that we can help the best